this is Travis with another video for you guys. Again, for those of you that don't know me, I'm a doctor of physical therapy, and I've also been a personal trainer for about 15 years. And so I just want to talk to you guys about some exercises for fairly low level or deconditioned patients. Certainly anybody who's had a prolonged hospitalization, and I know a lot of people that are having a bad go around with COVID, been ventilated, coming out of the ICU, you're going to lose strength very quickly. And so not only are you up against some of the medical issues that might hit you, but then you're also up against all this deconditioning where your body has just gotten really weak. And it can be difficult sometimes to know where to start. Many times in the acute hospitals, you don't always get a lot of therapy. And so you're just kind of left to lay in bed. And I've had a lot of patients kind of say that, they wish they had something to do. They wish they knew where to start. And so I hope this will speak to that. And, obviously you want to make sure you've cleared all your medical issues, make sure your doctors have cleared you to do any type of activity. Obviously if you're still in the hospital, you want to know where your lines are. Don't pull anything out. If you just had surgery, make sure your incisional precautions and spine precautions and things like that are all cleared. So a lot of caveats to this, but assuming that, you're just at a point now where you're ready to start exercising and you've been cleared, this can be a good place to start. And so if you're already in bed, that'll be great. If you can get down on a yoga mat and you want to start there, or even on a couch, that may work as well. And we'll go ahead and get started. Okay, so if you imagine I'm laying on a bed, it could be a hospital bed or any bed instead of a yoga mat, I'm going to just start laying on my back. And that's pretty much the simplest position to be in. And so from there, many of the muscles you're going to need to strengthen to get yourself walking again are what we call your extensor muscles. So it's your thighs, your glutes, and to an extent even your calves. And so assuming you don't have any spine precautions, just starting with even a simple hip bridge can be a good place to start to get some strength back in those glute muscles. And again, in the beginning, if you can't go up very high, clench and just initiate the lift is fine. And then eventually, hopefully that can progress into you doing a little bit of a lift off the ground. And then progressively from there, hopefully as you're getting stronger, you'll start to notice you can get up a little bit higher. And so ideally what you'd like to be able to do is get yourself to where you're just about in a straight line without really arching your back too much. You don't want to be too overarched. Just a neutral is fine, or you feel a good contraction in the glutes. And so that's a bridge, and that's a pretty straightforward maneuver when you don't have any equipment, and a really good way to start to put some strength back in those hip muscles. From here, you can start to also strengthen your thigh muscles on top by just doing a very simple leg extension. Okay, so again, I'm in what we call a hook lying position, so I'm not flat, my knees are bent, and then from there you're just going to try your best to straighten one leg at a time. Now for those of you that are pretty weak and it's hard to even hold your hip up there, because sometimes somebody might try to lift their leg and they just can't do it because their hip isn't even strong enough to hold themselves there, you can maybe get somebody to put some pillows or some towels behind your knee. You could even start from this position, okay? And we tend to call this a short arc quad. Now eventually, if you can, it would be nice though to be able to do that without the pillow, because that works your hip a little more isometrically while you also get some quadricep. And I showed a progression here in my mini band video. You could also eventually add a band around your ankles, but I think for many people just starting in this position, certainly can be hard enough. And so that's going to be for those quadricep muscles, which are the big players on the top of the thigh. After that, we can start to get in these calf muscles, which are pretty big players when it comes to walking. And so they're definitely going to help you also with your balance a little bit. And so a real simple way, again, same position, the hook lying position. All you're going to do from there is just try to lift your heels up. Now, if my feet are too far out, it's going to be pretty hard to get much lift. So if your knee range of motion is good enough, hopefully you can get your heels kind of close to your buttock area, and then just lift those heels up and down. Now some of the beds, if it's electric and you can lift yourself up a little more, you may also be able to put a little pressure down with your hands. And that's going to be one way to start to strengthen up your calves. But again, if you're not there yet, just doing this with your body weight may be enough. And that's some heel raises for the calf muscles, which are actually called the gastrocnemius and the soleus. But again, calves is good enough. And just know they can help a lot with walking and standing. Definitely can help with your balance. Okay, so the cool thing there with that little trio, so the hip bridge, the leg extension, and then the heel raise, is that it pretty much gets some of the major muscle groups that are really going to help with standing and walking again. And again, all you need to be doing is essentially laying on your back with your knees bent. So that really gets at some of the main players below the belt line. Now certainly there are other variations and ways to make that harder. For those of you who are familiar with my mini band series, I show how you can put bands sometimes around your ankles or your knees to make those a little harder. So definitely check out my mini band video if you want some ideas on how to do that. But again, I just want to show some body weight variations for the lower half. Okay, so now I'm going to get into some of the trunk and core muscles. And so again, I can go back into that same hook line position that I was in before. And then from there, just try and do a really simple march. And that'll start to get a little bit of strength going in some of those lower abdominal muscles. And so again, this is just a pretty basic way to start to get at some of that core and trunk strength, which can kind of help to support your body in a lot of different ways. Definitely can help keep you upright, and also can certainly help with your balance as well. And so again, you would just lay on your back. You know, many times if you have an electric bed and you're slightly leaning up, that's fine too. I'm just showing this flat here since I'm on the mat. And just try and do that until you get a little fatigue. Hopefully you're not feeling your back, you know, moving up and down. Just keep your torso as still as you can and just lift one leg at a time. Now the next exercise can work a little more towards the obliques, kind of on the side. And so a couple ways we can do this. The most basic way would be to start with a little bit of hip swiveling. Now some of you may be familiar with this who've seen my low back video. This is just a really simple way to also kind of loosen up your low back. You are actually working your obliques a little bit also. And if there's any pain with this, then obviously you would want to stop. But you know, in the beginning, you can even start with a real small rock and then gradually try to go a little bit farther in each direction, okay? Once you're getting that point a little bit more mastered and you're feeling stronger now, you could actually try to do a roll onto your side, okay? So if you roll all the way onto your side, go back, roll onto your side, and go back. Now this could be actually a pretty good way to strengthen some of the upper body. Now sometimes you might even have a bed rail you can hold onto, and you could either pull with one or both hands and kind of pull yourself over, you know, push maybe back to the center, grab your bed rail and pull yourself over, and that'd be a fine exercise to do as well. But if you didn't have any bed railing or you want to try to do it without it, you know, just see if you can kind of rotate over and just go side to side. And that's a nice way to work actually quite a bit of muscle at the same time. And again, even if you had a pretty narrow bed, you know, obviously if you don't feel like your balance is very good, you can have the nurses, you know, put a bed railing up for you if you're in a hospital type setting, or just make sure you're not so close to the edge you're going to actually fall off. You'll make sure there's enough room on each side. But that can be one way to start to just get a little bit of strength through the core and the midsection. Okay, so the last part I'm going to cover is a little more in the upper body department. Now, upper body strength is not going to be as critical for walking, obviously, but if you are using a walker, for instance, if you're so weak that you have to rely on something with your arms, then definitely indirectly upper body strength can help quite a bit. Even just pushing down into a cane, you know, grabbing onto a stair railing, there are a lot of situations where having upper body strength can really help your lower body as well. And so when these legs are weak, you know, the next thing in line many times will be your upper body. And so it's a little more challenging when you're in bed now to really do much for your upper body. Sometimes bed railing will have they'll put an up overhead trapeze, which is like a little triangular frame, almost looks like what you'd use in a billiard lounge. And you know, you could do some little pull-ups on that. So many times you'll have that, you know, trapeze bar, and you could almost do kind of like a rowing maneuver. If you imagine I had that in my hands right now. So for those of you who have access to that, that's a great exercise. Not everyone will though, so I'm not going to necessarily show that exercise, but I will show some very simple things you could do on the mat. If you imagine I was just laying down in bed, you can actually push the back of your elbows sort of isometrically into the mattress. And so I would just kind of push my elbows almost like if I was doing a rowing maneuver, but just from here. And you know, if you wanted to put some pillows behind your elbows to kind of give you a little more cushion, that's fine as well. You can certainly do that. But again, I'm going to go ahead and just push my elbows down and try to lift my body up just a little bit. Okay, I'm not necessarily crunching a whole bunch. I'm just kind of pushing down, trying to squeeze my shoulder blades together for a few seconds, you know, 3 to 5 seconds if you can. Don't hold your breath though, because many times when people do isometrics, they do hold their breath. Try to just kind of squeeze and see if you can still take a few breaths. Nice, good hold. And then back down. Push again, squeeze those shoulder blades together. Down and again, okay? And if you can build up to doing at least maybe 10, 15 of those for 3 to 5 second holds, that's a nice way to really get some strength. kind of in some of those upper back muscles, the muscles we call your scapular retractors. Okay, so last exercise is going to be the chest muscles. Now I'm going to put this one in the optional category because many patients, especially if you're connected to lines and different things, you aren't always going to be able to roll over on your stomach. So definitely you want to clear that you're going to be able to do that. If you're just at home though and you can roll over on your stomach, then definitely go ahead and give this a try. But I will put this one in the optional category. It's pretty difficult to really work your chest muscles when you're on your back. So you do have to roll over on your stomach area. And then from there, again, you could even do, you can keep your knees down and just start to do a modified push-up, okay? So again, you may not get very far. It might look something more like this in the beginning, as long as it doesn't, hurt your back here too much and it's just mostly across the front of the chest, that's fine. Hopefully, eventually though, you want to try to think about pushing your stomach off the mat. And so you're essentially doing a push-up. And so as I'm pushing, I have my hands pretty much in the same line as my chest. So you don't want to have your hands up here by your face and not necessarily too low either. We tend to have the most power kind of right in this zone here. And so that's a really nice way to start putting some strength back in the arms and shoulders. But again, definitely make sure that you're cleared to roll over on your stomach. Many times if you're in a hospital, nurses may not want you doing that. So certainly, again, make sure everyone's okay with that happening. But again, that is a cool exercise to do if you're able to do it. Okay, so just a few ideas there on how you might be able to start getting yourself back in the game. Many times, again, some of these things can sideline us, and even a short course of bed rest can weaken our bodies pretty quickly. And, again, it can be pretty difficult sometimes to know where to start. So once again, definitely make sure you're cleared for exercise and, incisions-wise, definitely medical status-wise, if you're having blood pressure issues and things like that, you want to make sure all that's pretty stable. And once it is, hopefully you can build from here. Certainly listen to your body, be gradual about resuming exercise again. When in doubt, I'd say if you're coming off of COVID, you don't necessarily want to overexert yourself, certainly not in the beginning until you've done things consistently and gotten a pretty good read on them. But as always, definitely comment below and let me know what you guys think. I'll put the links to the mini bands at the bottom. And again, you can certainly check out my mini band videos if you do have an interest in getting them. Now, at that next level, you can certainly do more of a chair-based exercise program. So definitely check out my chair exercise video for those of you looking to take that, one step even farther. But, for some people, even just sitting up in a chair is a pretty tall order. So this might be an easier place to start. This will probably be my last video for 2020, but definitely going to try to hit the ground running again in January. So definitely stay tuned. Been a crazy year, for certainly, and for some of you, a very tragic and horrific year. But I definitely wish you all the best. And to the extent you're able to, hope you have a happy and safe New Year.